Hello and welcome back to the training series on child growth assessment. In this segment, we will discuss Module C Part 2, which is dedicated to interpreting growth indicators. In this video, we will cover the following topics: interpreting, plotted points and z-scores and interpreting trends on a growth indicator, and how to identify growth problems. Interpreting plotted points means being able to read and derive information from a point on the growth indicators. But first, we have to understand what these lines mean. As you have seen in all growth indicator we have shown in this series, all of them contains lines like these and have these numbers written beside them. These are called the z-score lines. So, as already explained in the introduction part of this training, the World Health Organization conducted a study in 6 countries on children from birth to 5 years old. This study was done on children who followed the feeding recommendations as set by the World Health Organization. So the data collected from these children with normal growth is what is presented by this line right here on these indicators. The 0 line is the median line, meaning the average. So, looking at this weight for age, for example, at 6 months old, the average baby boy is 7.9 kilograms. At 1 year old, the average baby boy is 9.7 kilograms. And at 2 years old, the average baby boy is 12.2 kilograms. Now these other lines simply indicate how far away from the median or average a child is. These lines are guidelines that mark whether the child has a risk towards a growth problem, already has a growth problem, or whether the growth problem is severe. Usually, a point that is plotted above z-score 1 or below z-score -1 usually indicates a risk towards a growth problem. K point above z-score 2 or below z-score -2 usually means there is a growth problem. K point above z-score 3 or below z-score -3 will usually mean the growth problem is severe. This table right here is something that will prove very useful until you are able to remember what each indicator identifies. The grids, which are colored gray, means a point plotted in these ranges are considered normal. Now, we can see, for the length, for age, if a point falls above 3 z-score, that means the child is very tall. Tallness is rarely a problem, unless it is so excessive that it may indicate an endocrine disorder, such as a growth hormone-producing tumor. Refer a child in this range for assessment only if you suspect an endocrine disorder. For example, if parents of normal height have a child who is excessively tall for his or her age, otherwise this is rarely considered a problem. Z-score from -1 to 2 is considered normal and not a problem. A z-score below -1 simply means there is a risk for a growth problem, but the child is still within normal range. So we are not going to refer them, but simply watch them closely. However, a point plotted below z-score -2 means that this child is stunted, and below -3 means severely stunted. A child whose weight forage falls above the 2 or 3 z-score lines may have a growth problem, but this is better assessed from weight for length, height, or BMI for age. Do not use this indicator to assess for overweight or obesity. A z-score below -2 indicates that the child is underweight, and below -3 indicated the child is severely underweight. For the weight for length and BMI for age, a point falling above the 3 z-score line means obese, above 2 means overweight, and above 1 means a risk of overweight. Z-score below -2 means a wasted child, and below -3 means a severely wasted child. It is worth noting that a point falling exactly on a z-score line we will consider the child as having the less severe growth problem. So a point exactly on the 3 z-score line on the weight for length will be considered as overweight and not obese. The following weight for age chart is for a boy who is 1 year and 1 month old. He weighs 7.5 kilograms and is 70.3 centimeters in length. Notice that his weight for age is below the 2 z-score line. So he is considered underweight. A boy aged 3 years and 11 months, weighs 19.5 kilograms and is 109.6 centimeters tall. His weight for height, shown on the chart below, is in the normal range. The preceding examples showed problems that were identifiable by looking at one point on one growth chart. However, it is important to consider all of a child's growth charts together, particularly if only one of the charts shows a problem. Looking at the growth charts all together will help you to determine the nature of growth problems. It will also be important to consider trends observed over time. So next, let's take a look at how to interpret trends on a growth indicator. When a child has come for a visit 2 or more times, you will have to start joining the points on the indicators by a straight line. This line will show the growth trend of the child. Normally, a child will follow along the Z-score line they were born into. Trends help us identify whether a child is heading towards a growth problem or has a normal growth trend. There are 3 trends that we should Riemann alert for. These are: if a growth line crosses a Z-score line, if there is a sharp incline or decline, if there is stagnation or a flat line. These 3 trends are not always problematic. In some cases, they may even be beneficial. However, many times they may represent a growth problem, and we should remain alert for those cases. Let's explore each of them a little more. Growth lines that cross Z-score lines indicate a possible risk. Children who are growing and developing normally will generally be on or between 2 and 2 Z-scores of a given indicator. The growth of an individual child plotted over time is expected to track fairly close to the same Z-score. The figure presents 2 theoretical growth lines. In one of the lines, growth generally tracks along to Z-score, crossing it from time to time in a pattern that indicates no risk. The other line shows a boy's weight falling away from his expected growth track, although his growth line remains between -1 and -2 Z-score. This child has in fact crossed Z-scores, following a systematic trend that indicates risk. The interpretation of risk is based on where relative to the median the change in trend began and the child's health history. The growth line tends towards the median. This is probably a good change. If it tends away from the median, this likely signals a problem or risk of a problem. If a trend towards stunting, overweight, or underweight is noticed in time, it may be possible to intervene in good time to prevent a problem. Any sharp incline or decline in a child's growth line requires attention. The child has been ill or severely undernourished. A sharp incline is expected during the refeeding period as the child experiences catch-up growth. Otherwise, a sharp incline is not good, as it may signal a change in feeding practices that will result in overweight. The child has gained weight rapidly. Look also at height. If the child grew in weight only, this is a problem. If the child grew in weight and height proportionately, this is probably catch-up growth from previous undernutrition because of improvement in feeding or cure of previous infection. In this situation, the weight forage and height forage charts should show inclines, while the weight for height growth line tracks steadily along the Z-score curves. A sharp decline in the growth line of a normal or undernourished child indicates a growth problem to be investigated and remedied. Even if a child is overweight, he or she should not have a sharp decline in the growth line, as losing too much weight rapidly is undesirable. The overweight child should instead maintain his weight while increasing in height. That is, the child should grow into his weight. A flat growth line, also called stagnation, usually indicates a problem. If a child's weight stays the same over time as height or age increases, the child most likely has a problem. If height stays the same over time, the child is not growing. The exception is when an overweight or obese child is able to maintain the same weight over time, bringing the child to a healthier weight for height or BMI for age. If an overweight child is losing weight over time and the weight loss is reasonable, the child should continue to grow in height. However, if the child experiences no growth in height over time, there is a problem. This problem would be evident as a flat growth line on the height for age chart. For children in age groups where the growth rate is fast, as shown by steep growth curves, for example, during the first 6 months of life, even 1 month's stagnation in growth represents a possible problem. When interpreting risk of overweight, it is helpful to consider the weight of the child's parents. The child has an obese parent. This increases the child's risk of becoming overweight. A child with one obese parent has a 40% probability of being overweight. If both parents are obese, the probability goes up to 70%. It is important to know that overweight and obesity can coexist with stunting. This marks the end for Module C. Hope you've been able to understand so far. Let's meet in the next video for Module D.